So we're going to talk about the baroreceptor reflex, which is just one way that we maintain or regulate blood pressure. Okay, and so we're going to talk about this. It should be reviewed, but then we're going to talk about what happens to blood pressure during exercise. Okay, so we'll fix that real quick, during exercise. All right, so if we come back to this, blood pressure is under reflex control. It's a visceral reflex. It's not something you have to think about. It just happens. So if you have high blood pressure, body's going to do things to try and lower it. If you've got low blood pressure, your body's going to do things to try and increase it. Okay. Now, in order to be able to do this, we need to be able to measure pressure, and this occurs with baroreceptors. And so we've got baroreceptors in a couple of different places. And I'm going to highlight them here. We'll do it with green here. So we've got baroreceptors in our aorta, and we've got baroreceptors in our carotid artery. We also have chemoreceptors, which play a role, but that's not for the baroreflex. That's for the chemoreflex. Okay. And there's also some mechanoreceptors that are involved in your heart that we don't have. So some stretch receptors there as well. So like I said, the baroreceptors are located in the aortic arch and the carotid sinus, and they sense pressure via stretch. Okay, and so a good way to think about this is just imagine that you have a balloon and you draw a circle on it. Now what happens is to that circle when you blow up the balloon, when you increase pressure? Well, it stretches out, it gets bigger. That's essentially how baroreceptors work. And so when we have greater pressure, they stretch out more and they send more action potentials to the medulla, which helps regulate blood pressure. But if I have low pressure, the stretch decreases and fewer action potentials are sent out. Okay, and so we've got this this flow chart, and I've shown this. I use this in 220, but let's just say for some reason that we have high blood pressure. What are we going to do to counteract that? Well, we're going to increase the parasympathetic side, and we're going to decrease the sympathetic side. And if you remember the equation that we talked about earlier this week, mean arterial pressure equals heart rate times stroke volume times resistance. Well, if you look, we've got resistance, heart rate, and this is stroke volume, force of contraction, which plays into cardiac output and how they affect blood pressure. So we're going to talk about both branches of the autonomic nervous system. So with the parasympathetic side, this decreased stretch leads to fewer action potentials. And so we've got low pressure. Our brain says, well, let's reduce parasympathetic activity or tone, which will help increase pressure. We call this parasympathetic withdrawal. We don't release as much acetylcholine onto the SA node. The SA node fires more because we're not opening as many potassium channels. That's what happens here is these muscarinic cholinergic receptors open potassium channels, but if I open fewer potassium channels, less potassium can go out of the cell. Okay, that's what happens with the parasympathetic side. Okay, so this leads to an increase in heart rate. So we turn down the parasympathetic side to increase heart rate. Doesn't have any effect on stroke volume or resistance. Now on the sympathetic side, we release epi and norepi. Okay, norepi comes from the nerves generally, epinephrine comes from the adrenal gland. And so I've just got a table here to kind of summarize this. So we release more norepinephrine onto the SA node onto a beta adrenergic receptor. This causes an increased firing rate of the SA node, so we have an increased heart rate. Same thing happens norepinephrine. So here I'll do this just to be clear. Norepinephrine onto the SA node in the ventricles. That also activates an adrenergic receptor. And in this case, the contractility or the strength of contraction increases. And so for a given end diastolic volume or preload, we increase stroke volume. And then on the arterials, they have receptors for epi. Okay, and they activate alpha adrenergic receptors. A is for alpha, A is for arterials. They cause vasoconstriction, which causes increased resistance. Ultimately, all these things increase MAP. Okay, now the opposite would be true in both the sympathetic and the parasympathetic side if we had low blood pressure. Okay, so yeah. So how does exercise affect this? Well, remember, mean arterial pressure increases to help maintain oxygen delivery, but normally this increased pressure would activate the baroreceptor reflex. That would bring pressure back down to normal. And so what's the purpose of increasing pressure? Only to immediately decrease it. And so what happens is during exercise, your normal pressure is reset. So you, instead of saying, hey, I want a mean pressure of 90, your body's like, 95 is okay. I'm exercising. I know that I'm exercising, so I'm going to set this, have my set point be a little bit higher. Okay. After exercise, that mean arterial pressure is set back down to a normal point, and things happen. Increase parasympathetic activity, decrease sympathetic activity so that your pressure gets back down to normal. And so that is the baroreflex.